Doctor's best NAC detox regulators. Overview information. N-acetylcysteine comes from the amino acid L-cysteine. Amino acids are the building blocks of proteins. N-acetylcysteine has many uses as medicine. N-acetylcysteine is most commonly used by mouth for cough and other lung conditions. It is also used for flu, dry eye, and many other conditions, but there is no good scientific evidence to support many of these uses. Healthcare providers give N-acetylcysteine for conditions such as acetaminophen Panadol, Tylenol overdose. It is also given to reduce nitrate tolerance. How does it work? N-acetylcysteine treats acetaminophen Panadol, Tylenol poisoning by binding the poisonous forms of acetaminophen that are formed in the liver. It is also an antioxidant, so it may play a role in preventing cancer. Uses and effectiveness. Acetaminophen Panadol, Tylenol poisoning. N-acetylcysteine is effective in reducing the death rate and preventing the permanent harm caused by acetaminophen poisoning. For this use, N-acetylcysteine given by mouth is as effective as N-acetylcysteine given intravenously. Complete or partial lung collapse atelectasis. N-acetylcysteine helps treat collapsed lungs caused by mucus blockage. Lung tests. N-acetylcysteine is helpful when used to prepare people for diagnostic lung tests. Care of people with a tube placed in their windpipe. Tracheostomy care. N-acetylcysteine helps prevent crusting in people with a tube in their windpipe. Side effects and safety when taken by mouth. N-acetylcysteine is likely safe for most adults. It can cause nausea, vomiting, and diarrhea or constipation. Rarely, it can cause rashes, fever, headache, drowsiness, low blood pressure, and liver problems. N-acetylcysteine has an unpleasant odor that may make it hard to take. N-acetylcysteine is likely safe for most adults when given as a prescription medication. Rarely, it can cause rashes, fever, headache, drowsiness, low blood pressure, and liver problems. Special precautions and warnings. Pregnancy or breastfeeding. N-acetylcysteine is possibly safe when taken by mouth, delivered through a hole in the windpipe, or inhaled by women who are pregnant. N-acetylcysteine crosses the placenta, but there is no evidence that it harms the unborn child or mother. But N-acetylcysteine should only be used in pregnant women when medically needed. There is not enough reliable information about the safety of taking N-acetylcysteine if you are breastfeeding. Stay on the safe side and avoid use. Allergy. Don't use N-acetylcysteine if you are allergic to acetylcysteine. Asthma. There is a concern that N-acetylcysteine might cause bronchospasm in people with asthma if inhaled or taken by mouth or through a tube in the windpipe. If you take N-acetylcysteine and have asthma, you should be monitored by your healthcare provider. Bleeding disorder. N-acetylcysteine might slow blood clotting. There is concern that N-acetylcysteine might increase the risk of bruising and bleeding in people with bleeding disorders. Surgery. N-acetylcysteine might slow blood clotting. This might increase the risk of bleeding during and after surgery. Stop taking N-acetylcysteine at least 2 weeks before a scheduled surgery. Interaction. Do not take this combination. Nitroglycerin interacts with N-acetylcysteine. NAC nitroglycerin can dilate blood vessels and increase blood flow. Taking N-acetylcysteine seems to increase the effects of nitroglycerin. This could cause increased chance of side effects including headache, dizziness, and lightheadedness. Be cautious with this combination. Activated charcoal interacts with N-acetylcysteine. NAC. Activated charcoal is sometimes used to prevent poisoning in people who take too much acetaminophen and other medications. Activated charcoal can bind up these medications in the stomach and prevent them from being absorbed by the body. Taking N-acetylcysteine at the same time as activated charcoal might decrease how well it works for preventing poisoning. Click subscribe to Users Productions YouTube channel.